A very good morning to all of you, Honorable Chief Guest, our Managing Director, Principal Madam, Medical Superintendent and the Medical Director Dr. Satyanarayanan Sir, eminent speakers and participants. A warm welcome to all of you for this CME program, Medicon 2020, which is based on COVIDology. It's indeed a pleasure to invite all of you to join us in this one-day program with all eminent speakers nationally as well as internationally. Once again, a warm welcome and a big thank you for our management and our managing director for giving me this opportunity to present a short speech on our experiences at Karpaga Vinayagar Institute of Medical Sciences and Research Center. To start with, a picture of our triad center at the institution. The outlines of my speech was going to include how did we go about organizational setup, essential resources planning, and how did we take care of our employees during this COVID healthcare. Statistics from our institution: 816 COVID cases as on 20th of this month, out of which 12 cases had died, and the males were 447 with females of 269. An average stay at the hospital was between 7 to 10 days. The first step was to do two changes in the institution. An organizational modifications was needed. Hand washing area outside the OP department, triage had to be set up outside the OP. Isolation ward for keeping patients who were suspects, and ICU with ventilators for patients with SARS. We had an exclusive COVID ward set up with beds allocated around 210 beds, all of them with oxygen supply, and cordoned off pathways to the wards and isolating the ward from rest of the wards was also made. And all these arrangements were made within the information had come to us. Yes, ma'am?
Yeah, you are audible.
As soon as the information had come to us from the government. The other things which we had to do were imaging services, laboratory services for throat swab testing, and training of healthcare workers regarding donning and doffing of PPE. I should make a special mention regarding online communication system, where we had communication between not only the department faculty, but also with the administrators and also with the government officials. We had to update a portal called Stop Corona every day, in which the census of patients had to be updated at 9 o'clock in the morning. Essential resources planning included human resources, especially the workforce. We had to eliminate susceptibles, especially aged more than 40 years, and patients with, the staff nurses or the doctors with comorbidities, allocating wards and having a roster, a COVID ward roster, by which the doctors as well as healthcare workers were taking care of the patients. Medications had to be taken care of also, stocking up the pharmacies with antiviral agents, disinfectants as well as the protective gear, and food for the patients. Food was given according to what the Tamil Nadu government had given us a menu, and it especially included a lot of proteins and a diet which was packaged, and measures were taken to dispose of the packaged food. The utmost importance of the employees and the safety of the employer by lot of training sessions regarding off and donning of healthcare workers, having classes to them regarding to alleviate apprehension for working in COVID ward, chemoprophylaxis with hydroxychloroquine. Also, testing was done after their rotation COVID ward duty, and self-isolation also. Salient features of given by the government of Tamil Nadu. The average stay in the hospital was between 7 to 10 days, which with a very affordable cost. We catered to a lot of rural population in and around Madurandagam. So we had patients hospital employees. The challenges which we faced during the COVID pandemic and during the treatment, especially during early days when we had guidelines for treatment which was changing very often. But we had overcome this by attending a lot of Zoom meetings by the government of Tamil Nadu, thrice weekly virtual meetings. They gave us inputs on how to go about and make a treatment protocol, which we followed at our hospital. Like I said, initial early days, we had problems in handling deaths and disposal of bodies. But again, we asked help from the government officials. They helped us. And the most important challenge, biggest challenge was decision making, both medical and administrative issues, which were handled very easily by our managing director, as well as our principal madam and medical director, sir. Challenges faced from and by the patients, from the patients as well as by the patients. They had come to us and after 5 days or 6 days of onset of symptoms with moderate or severe symptoms of COVID, which could be justified by their poor economic resources. It took a lot of effort to convince them for COVID testing, especially when they had come to us with stroke or acute myocardial infarction or a cardiac failure. Sometimes some patients with mild symptoms had asked us for an early discharge. They just stayed in the hospital for 2 or 3 days. On the third day, they had wanted to go home. But after over a period of time, they began to realize that being at the hospital is for the safety of them as well as the safety of the other family members. Still, there's poor awareness regarding COVID, regarding masking, regarding social distancing, as well as hand hygiene. I think the more and more we try to make people aware, they will tend to understand things about prevention of COVID. Our future plans at Karpaga Vinayaga Institute of Medical Sciences to be able to handle post-COVID sequelae and strict infection control practices adherence, and of course vitamin D prophylaxis for patients with comorbids, which we are already doing it. But finally, most important thing is adult immunization. I'm not here to talk about COVID vaccine. I'm sure there are a lot of speakers who are going to talk about it. When I said adult immunization, I take pride in saying that in our unit, we make it a point to immunize patients with comorbids with flu vaccine and pneumococcal vaccine. What I had done prior to pre-COVID, I'm continuing to do so during COVID period also. I'm sure there must be a small amount of benefit by vaccinating them with the influenza vaccine and pneumococcal vaccine. Okay. The lessons we have learned from COVID we wanted fast and instant solutions to problems. There has been a much change in the attitude of patients. We have regained more belief in the healthcare system and doctors. And as doctors, we have to tackle comorbids very aggressively. Personal hygiene has to take more importance. And when in doubt, ask for help. I have always asked for help from my colleagues, from government officials, from our administrators, and they're always ready. They're giving me a big support. Adhere to strict infection control practices, health awareness to all and health for all, and finally, teamwork works. Our team includes our managing director, the administrators, Department of Medicine. I need to make a special mention regarding our senior residents, Dr. Vasant, Dr. Suresh, and Dr. Rajashekharan, who have been the executing officer for this COVID care in our institution. All of the postgraduates and interns were not involved in COVID care. However, they were running around for collecting data and investigations. Clinical as well as non-clinical departments, staff nurses, laboratory services, medical records department, as well as colleagues from the Tamil Nadu government. I conclude with this slide, and once again, thank you for having me here.